The Spine Institute of Southwest Florida. We'll be learning about the spine, the occurrence of a tethered spine, and tethered spine ultrasound. The spine is composed of 33 vertebrae which run from the base of your neck to your tailbone. The 5 sections of the spine are the cervical, which is the first 7, thoracic, which is the next 12, lumbar, which is the next 5, sacrum, which is 5 fused, and the coccyx, which is 3 to 5 fused. The spine is to protect our spinal cord and nerves from harm while supporting the weight of our bodies. Our spine also has a curvature, which provides our body with the proper flexibility. Now that we have learned about the anatomy of the spine, we will now learn about the occurrence of a tethered spine and how it differs from a normal spinal cord. For the purpose of this video, this will be our spinal column, this balloon, this will be our brain, and this attachment will be our spinal cord. The spine is a neurological disorder that starts in the womb. When development is normal, the spinal cord can move freely throughout the spinal column, as seen here. However, a tethered spinal cord occurs when the spinal cord becomes pinned down. As you can see, it's pinned down to the lower vertebrae and attaches to the tissue of the spine. Roughly 80% of tethered spinal cords cases are present at the lower back. Now that you have learned about a tethered spine, you may ask, how did this occur? A tethered spinal cord can occur from the spinal cord not developing properly, sometimes due to things like spinal bifida, undergoing spinal surgery and scarring weighing down the spinal cord, or a tumor. Common signs and symptoms of a tethered spinal cord are an unusual dimple or raised lump on the lower back, hairy patch on the lower back, one leg or foot that is noticeably longer than the other, back or leg pain, difficulty standing and walking, or numbness in the legs or feet. Now that we have learned about the anatomy of the spine and the occurrence of a tethered spine, we will now turn our attention to a tethered spine ultrasound. Ultrasound is a painless procedure which is non-invasive and does not require the use of anesthesia or any other patient preparation. Once the ultrasound technician completes the scan, the radiologist will interpret the results and your doctor will be in touch with you within the findings within 24 to 48 hours. Now you may ask, what if it is found that you have a tethered spine? Is surgery necessary? The answer is not necessarily, and is measured on a case-by-case basis. Usually surgery is only performed when the patient is suffering from severe symptoms of a tethered spine, such as discomfort or pain. Luckily, with a tethered spine surgery, most patients are back to normal activities within a few weeks. Now let's turn things over to Dr. Barnes, who will demonstrate what occurs during a tethered spinal cord surgery.
As you can see here, the spinal cord is tethered and pinned down all the way at the end of the vertebral column. During surgery, we go in with our micro scissors between the vertebral bones and cut the end of the filum terminalis, which is a delicate filament near the tailbone. Once this occurs, the spinal cord can properly ride free, as is demonstrated in this example.
Thank you for joining us at the Spine Institute of Southwest Florida.